Dan Williams, Survive Outdoors, where we do wilderness medicine videos, how to keep you safe in the outdoors, how to get you back home, and some gear reviews. So I've listened to the polls, and the polls were pretty well overwhelming in terms of you guys want to see more survival hacks. So the next video, we got a really good one coming up. I'm just prepping you. We're going to do all kinds of hacks that I think are going to help you down the road. And that's what that is. Today, we're going to do something a little different. And YouTube it definitely is out there for a bunch of different kind of people. But actually, this is really good. If you went to, and if you haven't, go to my diarrhea chart about 3 charts ago and look at the diatribe I got from a guy named Silver Commander. So check that out. His wife's a doctor and just basically was slanderous and nuts. I had one guy come to my rescue. It was kind of nice, but this is great. And the reason why it's great is because I understand now why a lot of docs, nurse practitioners, and PAs, those are your 3 main categories, why they often post like their resume in the beginning of their video. Some people even showing their diplomas. I have never done that. I'm easily found on LinkedIn. You can see right there where I'm at, and I've been doing this for about 40 years. I also have a doctorate in clinical psych. So when I saw these guys comment, oh, he even nailed the the baby boomers, us guys out there that are 60 and over. So he obviously has a bone to pick, but it was really helpful for me. It was helpful because I thought to myself, there's a lot of people out there that don't even know what a PA is. I ran across this woman, and her name, her YouTube site is called Posh PA. She's fantastic. I'm going to put her link at the bottom. You should check it out for sure. It's really great. So what is a PA? Well, no, it's not a parking attendant. I can do that, but that's not what it is. A PA is a healthcare provider that started by this guy, Dr. Steed, in 1963-64. It says 1965. The idea was brewing just prior to that, but he started this course in 1965 out of Duke, hence the first graduating class in 1967. This was because all the medics are coming out of Vietnam extremely well trained. So the first year at Duke University, and as it is pretty well now, things are refined, but the first year of a PA program is literally the first 18 months that MDs and DOs get, Doctor of Osteopathic. In fact, PAs and MDs at a lot of PA schools where they have the combined PA program, MD program, are literally in the same class. So that's what that is. The second year, we do rotations: cardiology, neurology, surgery, emergency medicine, pediatrics, OBGYN, all of the rest. So we can also pick an elective. A lot of the schools where you can pick an elective, 1 or 2 months where you can pick what you want to go into. Now, the profession has changed dramatically over the years in many ways. One, in 2021, our name is changed to physician associate. And that's not federally changed yet. It's going to be a state by state, a slow process. I'm guessing 10 years. It'll take, I won't be in the profession at that point. Second thing is, right now there are 5 or 8 states where a PA can practice independently. And they can open up their own clinic. They have a contract with the physician, and they don't need the supervising or collaborative, as it's called now, physician. Those states are Utah, Wyoming, Montana, Arizona, North Dakota, and like 2 or 3 others. So that's significant. I don't prefer that. I was accepted to medical school, chose to go to PA school, and extremely happy with how it went. So very pleased with the profession. It really comes down to having a physician that you can call on the phone, that you have a good dance with. And I've been really fortunate. I've had 2 or 3 that have been excellent. And then there's something called, very important, it's called scope of practice. Scope of practice is what you and this physician, collaborative physician, come up with, decide on what you're capable of doing. So I have been fortunate. We had a guy that owned a clinic that was extremely aggressive. He was awesome. I've done digit-tip amputations. I've done extensor tendon repairs and reduction of fractures and all kinds of procedures. So it all depends on what the PA delves into and what their specialty is and what they want to focus on. It's one of the benefits of a PA. They want to switch and go into derm, they go into derm. About those 5 or 8 states that allows independent practice, one of the things you have to have is 10,000 hours in that specialty before you're signed off where you can open up your own practice. 10,000 hours amounts to about 1 year of training. You're doing 40 hours a week. So growing up 6 hours south of where I live now, way down in southern Illinois, my livelihood back then with my father, who was a carpenter, we basically literally hunted and fished, tracked, trapped, you name it, to basically stock the freezer to save on bills and the grocery bill. And so I just fell in love with the outdoors, and being in the outdoors, the serenity, being at peace with that is extremely important to me. So about 2005, I went to a conference for healthcare providers, and I looked around and there was nothing out there for non-medical providers. So in 2008, Survive Outdoors was born. We had that company for, I don't know, 9 or 10 years. We sold it, and then 4 years ago, we just bought it back. So here we are. Diarrhea. How in the world am I jumping to diarrhea? So on that short, I talk about that if you're out in the woods, you're hiking, a few days of getting back, take 2 tablets of Imodium on your way out daily if there's no blood and no fever. And that's right out of the book, my boys. It's right out of there. Low paramide Imodium is somewhat of an opiate. It can cause CNS depression. It can make you drowsy. Here's the deal. The prescription and how you should take it is 2 pills after your first watery diarrhea, then 1 after your next watery diarrhea, and then 1 after your next watery diarrhea, and then you're done. No more than 4 in 24 hours. That's 2, 4, 5, that's 8 milligrams. Never go above 16 milligrams. Not good. There's been a lot of individuals having issues with Imodium. So when he says, you know, when Silver Commander says, well, my wife thinks this is a terrible thing. Well, first of all, I'm advising this for survival in the outdoors. It's not something I discuss with my patients. If you're having diarrhea 3 days or longer, come in, then we do stool cultures and the whole 9 yards. And my advice, not medical advice, my suggestions is you take 2 Imodium daily. Get back on the trail so you can get out of there without other people having it very easy to find your trail and find that diarrhea on the way. That is 1, 2, 3, that's 3 times lower than the daily dose. Very safe. Word of caution, heart disease, things like QT prolongation. There are other issues that I'm not going to go into where you should not take it on a routine basis. Never do I advise you to take it. We're talking about a survival situation in the outdoors, hiking back. Really want to make that clarification. I'm not going to have a rebuttal video on everyone, but this guy really helped me out, and I want to tell him thank you. He helped me out where I thought, how many of my audience, how many guys and girls out there, how many do not know what a PA is or a nurse practitioner? So that's what I do. That's how I got to that point. That's how I got to the point of working solo now for 30 plus years. All right, guys, I hope that helps clarify a little bit in terms of my profession and what I do and why I'm pretty obsessed with wilderness medicine. Next video, we're going to do survival hacks. I think you're going to like that one. All right, take care, guys. Keep your eyes on the horizon, your face to the wind.